Do you often experience heart palpitations and wonder how to manage them? If so, you're not alone, and you've come to the right place. In this video, we will delve into the world of heart palpitations, helping you understand this common yet sometimes alarming phenomenon. First off, what exactly are heart palpitations? Well, they are feelings or sensations that your heart is pounding, fluttering, or beating irregularly, often for just a few seconds or minutes. You might feel heart palpitations in your throat or neck as well as your chest. They can be scary, but they're usually not serious and often don't require treatment. So what causes these palpitations? The reasons can be many and varied, from stress, anxiety, and panic attacks, to hormonal changes, certain medications, and even the food and drinks we consume. However, it's important to note that heart palpitations could also be a symptom of a more serious heart condition. Understanding your condition is the first step towards managing it. Stay tuned as we navigate through the causes, management strategies, and immediate relief for heart palpitations. Ever wondered what causes these heart palpitations? Well, let's dive right in. Heart palpitations are often related to anxiety or emotional stress. When we're worried or frightened, our bodies release adrenaline, which can speed up our heart rate. Pregnancy can also lead to heart palpitations, thanks to the extra blood flow and hormonal changes. Certain medications, like those for asthma or thyroid conditions, can stimulate your heart, causing it to beat faster or irregularly. Lifestyle factors play a significant role too. Consuming too much caffeine or alcohol, being dehydrated, or not getting enough sleep can all trigger palpitations. And let's not forget about certain medical conditions such as an overactive thyroid or low blood sugar, which can cause your heart to flutter. Understanding these causes is crucial because it helps you pinpoint what might be causing your palpitations. Identifying the cause can help you find the right management strategy. Waking up with palpitations can be scary, but there are ways to manage it. So let's talk about how to manage those unsettling morning heart palpitations. Firstly, maintaining a regular sleep schedule is crucial. Your body thrives on routine, and a consistent sleep pattern can help reduce the frequency of morning palpitations. Try to go to bed and wake up at the same time each day, even on weekends. Next, it's important to be mindful of what you consume. Caffeine is a common trigger for heart palpitations. So that morning cup of joe? It might be doing more harm than good. Consider switching to a caffeine-free alternative or reducing your intake to see if it makes a difference. Remember, stress and anxiety can also be contributing factors. Incorporating stress management techniques into your morning routine, like meditation or deep breathing exercises, could be beneficial. Starting your day right can help keep palpitations at bay. So take control of your mornings, and you may just find those heart palpitations becoming a thing of the past. Pregnancy can bring about many changes, including heart palpitations. These can feel unsettling, but remember, it's quite common and often linked to hormonal shifts. Managing these palpitations starts with understanding that they're typically harmless. However, if they persist, it's always a good idea to consult your healthcare provider. Staying hydrated is crucial, as dehydration can often trigger palpitations. So aim to drink plenty of water throughout the day. Next, consider practicing relaxation techniques. Deep breathing exercises, yoga, and meditation can help calm your mind and ease your heart rate. Try to limit your intake of stimulants like caffeine, which can exacerbate palpitations. And maintain a balanced diet rich in magnesium and potassium, nutrients that support heart health. Lastly, remember to get plenty of rest. Pregnancy is a time of great physical and emotional change, so don't overlook the importance of sleep. Taking care of your health during pregnancy can also help manage heart palpitations. Anxiety and heart palpitations often go hand in hand. Anxiety, as many of us know, can manifest itself physically in a variety of ways. One such manifestation is heart palpitations. This is because during periods of high stress or anxiety, the body releases adrenaline, a hormone that increases your heart rate, causing that familiar fluttering sensation in your chest. So how do we manage this? The key is to first manage the root cause, which in this case is anxiety. When we handle our anxiety, we can often alleviate our heart palpitations as a result. One effective method to control anxiety is through deep breathing exercises. When we're anxious, our breathing can become quick and shallow, which may contribute to heart palpitations. By taking slow, deep breaths, we can help our bodies to relax and reduce the release of adrenaline. You can start by inhaling deeply through your nose, holding your breath for a few seconds, and then exhaling slowly through your mouth. Repeat this process for a few minutes until you start to feel calmer. Mindfulness techniques can also be incredibly beneficial. Mindfulness involves focusing on the present moment without judgment. It's about acknowledging your feelings and sensations without reacting to them. You might focus on the sensation of your breath going in and out, or the feeling of your feet on the ground. By bringing your attention to the here and now, you can help reduce feelings of anxiety and, in turn, manage heart palpitations. Other strategies include regular physical activity, which has been proven to reduce anxiety over time, and maintaining a balanced diet. Avoiding stimulants such as caffeine and nicotine, which can exacerbate heart palpitations, is also advisable. Remember, everyone is unique, and what works for one person may not work for another. It's about finding what techniques work best for you and incorporating them into your routine. In conclusion, managing anxiety is a critical step in managing heart palpitations. By incorporating techniques like deep breathing, mindfulness, regular exercise, and a balanced diet, you can help reduce both your anxiety and your heart palpitations. Managing your anxiety can also help manage your heart palpitations. Need immediate relief from heart palpitations? Here are some strategies. When your heart is racing, pounding, or fluttering, it can be quite alarming. Fortunately, there are immediate techniques you can use to help bring your heart rate back to normal. One such technique is the Valsalva maneuver, which involves holding your breath and straining as if you're trying to have a bowel movement. This can stimulate your vagus nerve, which in turn can slow your heart rate. Another technique is the carotid sinus massage. This involves gently rubbing your carotid artery, which is located in your neck. This massage can also stimulate your vagus nerve and slow your heart rate. However, this technique should only be done on one side of your neck at a time, and not if you have a history of stroke or mini strokes. It's important to note that while these methods can provide immediate relief, they are not a replacement for medical treatment. If your heart palpitations are frequent, severe, or accompanied by other symptoms such as dizziness or chest pain, it's crucial to seek medical help right away. Moreover, before you try any of these techniques, it's essential to consult a healthcare provider. They can guide you on how to perform these techniques safely and determine whether they are suitable for you. For instance, the carotid sinus massage is not recommended for those with carotid artery disease. In addition to these immediate techniques, maintaining a healthy lifestyle can help manage heart palpitations. This includes regular exercise, a balanced diet, adequate rest, and avoiding triggers such as caffeine, alcohol, and stress. Remember, heart palpitations are usually harmless, but they can be a sign of a more serious condition. Don't ignore your symptoms. Speak with a healthcare provider to understand what's causing your heart palpitations and how best to manage them. Quick relief is possible, but always prioritize safety. Let's revisit what we've learned about managing heart palpitations. We started our journey by understanding heart palpitations, those unsettling sensations of a racing, pounding, or fluttering heartbeat. We discovered that these sensations are often harmless, but can sometimes indicate underlying medical conditions. Next, we dove into why heart palpitations occur, exploring a range of triggers from emotional states such as stress, anxiety, and panic, to certain foods, beverages, or medications, to hormonal changes, especially in women. We then moved on to specific situations, starting with managing heart palpitations in the morning. We learned that consistent morning routines, including gentle exercise, mindful breathing, and a balanced breakfast, can make a significant difference. Our discussion about coping with heart palpitations during pregnancy emphasized the importance of relaxation techniques, staying hydrated, and maintaining a healthy diet. We also stressed the need for regular prenatal checkups to monitor both mother and baby's health. In managing heart palpitations associated with anxiety, we explored the power of mindfulness, cognitive behavioral therapy, and certain lifestyle changes. These tools can help us not only manage our heart palpitations, but also address the root cause of our anxiety. As we turned our focus to immediate relief from heart palpitations, we discussed a number of techniques. These include the Valsalva maneuver, deep breathing exercises, and maintaining a calm environment. We also highlighted the importance of seeking immediate medical attention if these palpitations are accompanied by symptoms such as chest pain, shortness of breath, or fainting. Now, as we wrap up, it's crucial to remember one thing. If your heart palpitations are persistent, severe, or associated with other worrying symptoms, don't hesitate to consult a healthcare provider. Your health and well-being should always be your top priority, and professional medical advice is irreplaceable. Remember, you have the power to manage your heart palpitations and improve your quality of life. By understanding your body, practicing self-care, and seeking help when needed, you can navigate this journey with confidence and grace.